What is the difference between benign and malignant thyroid nodules pre-surgery? Imagine feeling a lump in your neck and wondering if it's something harmless or something more serious. That's where understanding the difference between benign and malignant thyroid nodules becomes really important. Before any surgery, doctors relying on several careful assessments to figure out what kind of nodule they're dealing with. These evaluations help decide whether surgery is necessary and what kind of treatment might be best. Benign thyroid nodules are non-cancerous growths. They usually don't cause symptoms and are often found by accident during routine exams or imaging tests for other issues. These nodules tend to grow very slowly or not at all. On the other hand, malignant nodules are cancerous and have the potential to invade nearby tissues or spread to other parts of the body. Recognizing these differences early is key to effective treatment. Doctors start with a physical exam and look for signs that might suggest cancer. For example, a nodule that feels firm, fixed in place, or is growing quickly could raise suspicion. Sometimes patients notice symptoms like hoarseness or see enlarged lymph nodes on the same side of the neck, but these signs often show up later and aren't enough alone to make a diagnosis. Ultrasound imaging is the first step in evaluating a thyroid nodule. It helps identify features that suggest whether a nodule is benign or malignant. Benign nodules usually look cystic or spongy, have smooth borders, and reflected sound waves similarly or more than the surrounding tissue. They rarely have microcalcifications. Malignant nodules tend to be solid, darker on ultrasound, with irregular or microlobulated edges. They may have tiny calcium deposits called microcalcifications, and they often grow taller than wide, which is a suspicious shape. If a nodule shows these features and is at least 1 centimeter in size, a biopsy is usually recommended. The most reliable pre-surgical test is the fine needle aspiration biopsy. It involves inserting a thin needle into the nodule to collect cells for microscopic examination. The results are categorized using the Bethesda system, which helps guide management. For example, if the biopsy shows benign cells, the nodule is unlikely to be cancerous, and surgery might not be needed. If it shows cancer cells, surgery is generally recommended. Sometimes, results are indeterminate or suspicious, and further testing or monitoring might be necessary. Monitoring how the nodule changes over time also provides clues. Malignant nodules tend to grow faster and more often than benign ones. If a nodule increases in size by more than 2 millimeters per year, doctors may consider it more suspicious and decide on further action. Laboratory tests that measure thyroid hormone levels can tell us if a nodule is hyperfunctioning or hypofunctioning. Hyperfunctioning nodules produce excess thyroid hormone and are rarely malignant. However, these tests can't reliably tell us if a nodule is benign or malignant on their own. In summary, distinguishing benign from malignant thyroid nodules before surgery involves a combination of ultrasound imaging, biopsy results, clinical signs, and growth patterns. Ultrasound helps identify which nodules need a biopsy, and the biopsy provides the most definitive information. This careful process ensures that surgery is only performed when necessary, reducing unnecessary procedures and helping patients receive the most appropriate care. Always remember, if you find a thyroid nodule or have concerns, consult a healthcare professional for personalized advice and thorough evaluation.